Welcome to Healthy Mind, Body, and Spirit. Dr. Giavonne Rondo, and we are in season 4. And I have an extra special guest today that I have actually been trying to get on this show for 3 seasons. So welcome, Dr. McCants. Tell us about yourself and how did you get into the field of medicine?
All right. Well, first of all, thank you. And I'm sorry it's taken three seasons to
so
get
busy.
me here. So I am Kelly McCants. I direct the Institute for Health Equity at Norton Healthcare, as well as the Advanced Heart Failure Program.
Wow.
And my start in medicine is long, but I think the key points are that mentorship is so important, particularly if you don't see Black doctors and professionals. Having someone be a mentor and push you there is so important. And I've had some great mentors along the way, starting out in high school and again in college and finally even in medical school. And so my journey is a little bit different than most in that I'm one of the first to graduate college in my family, first physician.
Congratulations. Wow.
You know, just an awesome journey.
So you actually, you talked about mentorship, so you actually started seeing other African American, physicians in high school?
So actually, no.
Oh.
And so I grew up first in Jacksonville, Florida, and then my family moved to Tuscaloosa, Alabama.
Oh, wow.
And their mentorship looked different. It looked like Indian females and males, white males and females, because at the time there weren't a lot of Black professionals doing what we do. And I started out with an interest in biology.
Okay.
And as I was dissecting starfish, I got an opportunity to do some work at the University of Alabama with the National Institute of Health. They had a minority sponsorship program, and it led me to Tennessee State, kept going with the NIH and another minority sponsored program, and then on to Meharry and so on and so forth.
HBCU?
Yes.
Absolutely.
So I'm a double HBCU.
Yes, yes.
Tennessee State and Meharry.
Wow.
Yeah.
Just amazing. So how did you get into the field of cardiology in particular?
So I like all of medicine. You know, when you go through medical school and training, you try to find that niche area that sparks you. I liked it all. But again, go back to mentorship. I had a mentor by the name of Sumant Prabhu, who was a cardiologist, still is a cardiologist, and he saw something in me and thought I should be doing cardiology. And I respected him so much that I said, you know what, you're the smartest person I know, and I like what you do in terms of the way he approached cases, his bedside manner, the way he taught. And I said, if you think I can do this, then if you support me, I'll do it. And so I ended up in cardiology with his recommendation. No formal application process.
Wow.
So mentorship and support got me into cardiology.
Just amazing.
Yeah.
Absolutely amazing. And so cardiology is super important for our community.
Absolutely.
And particularly when it comes to high blood pressure and a condition called congestive heart failure or heart failure. Now, you are the director of the heart failure facility there at Norton Healthcare. So tell us a little bit about what is heart failure and what you're doing with the Institute.
Sure. So you brought up something very important. Cardiovascular disease is the #1 killer of all. But when we start thinking about African Americans, hypertension we cannot escape.
Yes.
And for me, if there was one preventable disease state, it would be hypertension, because there's a direct pathway from uncontrolled high blood pressure or hypertension to heart failure. And so most of the patients that I see with heart failure are young. They're African Americans, sometimes under the age of 40, and they present with heart failure at a time where sometimes I'm their first visit to a provider, and I have the unpleasant approach of saying, hey, guess what? You have a failing heart. And for those at home, heart failure just means the heart has an inability to pump blood to the rest of the body, and you have symptoms of shortness of breath. Sometimes you'll have chest pain. Sometimes you'll have swelling of your lower extremities, and often you cannot lay flat in the bed without gasping for air. And so for us, managing high blood pressure is extremely important.
So that's basically step one.
Step one.
Yeah.
And the unique part is it is preventable. If you can maintain a good diet, low in salt, if you're prescribed medications for your blood pressure.
Actually taking it?
Actually taking, knowing what they are and actually taking them, and exercising, doing the things that we know we should be doing.
Okay. So there is, and I've been hearing them, a few commercials over the radio about this genetic test. So can you go into some detail about that, about there's some genetic testing when it comes to congestive heart failure, and who should be tested?
Sure. So when we start thinking about genetic testing in heart failure, I want to be clear that that is a small subset of patients that go on to heart failure. And usually there's a familial pattern, means someone in your family had a diagnosis of heart failure, and sometimes you may not have known it until they end up on the heart transplant list, or they're at the end of their heart failure. And usually that is not necessarily the way that most African Americans end up with heart failure. But there are some testing, some labs that can be done if someone in your family has had heart failure or a dilated cardiomyopathy at an early age. There's some genetic testing that can be done. The most important part about genetic testing is the counseling that's associated with it. Because a lot of times you're fearful that you have a genetic predisposition to a heart disease or a cardiomyopathy, but that doesn't mean you're going to automatically have the phenotype or the heart failure. And so having that counselor present to walk through what the risks are and what you should do after testing is extremely important.
Okay, so it's not just, oh, let's test a whole bunch of people.
No.
We need to actually take some steps to look into our family history first.
To make sure there's a pattern.
Okay.
That's right.
Okay.
That's right.
So if, say, for instance, you have maybe a distant cousin who had congestive heart failure, that's probably not going to be it, but possibly if your mom or dad or a first-degree
Definitely.
relative.
So
Okay.
ideally first-degree relatives.
Okay.
Now, in some situations, cousins and so forth can be an indicator, but for most often we're talking about first-degree relatives.
Okay. Now, let's kind of backtrack a little bit. Our community, unfortunately, is seeing this more. And you talked about high blood pressure being the biggest issue. Are there other factors that play a role when it comes to congestive heart failure, or just even high blood pressure in and of itself?
So obesity, high blood pressure, and diabetes, almost that triad leads you to all cardiovascular disease, but specifically heart failure. And hypertension is still the leader. But there is some combination that I'm seeing in young African Americans that have high blood pressure and they're overweight. They present with a more, I would say, more embarrassed or a worse form of cardiomyopathy or heart failure at their presentation.
More severe?
More severe.
At a young, wow.
Yeah. And so, again, often it's the first time that I meet them that I find out they have a weakened heart muscle. They're usually obese. They usually are starting on medications for the first time. But I think the most concerning part is that they often present with kidney disease at the time that they meet me. And we know that the kidneys are the report card for the heart. If your kidneys start to fail and you have a weakened heart, then we're really missing the opportunity to intervene.
Wow. So it sounds like one of the things that probably needs to occur too is to have a regular primary care provider that can see you and kind of do some of those tests before you're actually
That's right.
symptomatic.
Yeah.
So yeah, big proponent for prevention.
Prevention
Yes.
is the key, and the most important part of prevention is having access, which leads us to why I'm interested in health equity, because
Great segue.
Great
Yes.
segue, and often what we see in underserved communities, access is an issue. So you mentioned seeing your provider and having those preventative checks. Well, if you don't have providers that are located in your community that you have access to, it makes it difficult to have those screening mechanisms to prevent heart failure.
Absolutely. Yeah. So that you mentioned access, but also being actually in the community in and of itself. And so Norton Healthcare is doing some just amazing things when it comes to bringing access and being accessible. So can you talk more
Sure.
about that, not only the Institute, but also the hospital?
So we'll work backwards.
Okay, okay.
So the hospital, we're very excited about building the first hospital in 150 years in the west end of Louisville. And, it's time. And so our CEO and our leadership team started us down this pathway about 2.5 years ago with the development of the Institute for Health Equity, which is essentially the community.
So
that was the flagship.
Start, yeah.
Which is the community-facing part of the organization. So most organizations have a DEI division, diversity, equity, and inclusion, but you add that external-facing component, which is the Institute for Health Equity, so that your organization is not only accountable for how you deal with the community, but also it builds relationships with the community so that it's a collaborative approach and not a, hey, we think we know what you need and this is what it is. No, my job is to get the inventory, take it back to the organization, and make sure we're collaborative in how we deal with the community.
Very smart.
Yeah.
Very, wow.
Really excited
Very
about that.
forward thinking.
Yeah.
So, yeah. So, in your role, exactly what are you doing in terms of, with that, which just being a forward-facing entity?
So building relationships, linking people to resources. One of the parts of our institute that I'm so excited about is our community health worker program. So we have almost 12 community health workers that go out to the community and link people to resources. Whether those resources are within Norton Healthcare or in other community-based organizations, doesn't matter. We just want you to have resources. And so we have different locations where our community health workers visit. I can't name all of them, but they're dispersed in the West End and throughout the metro area. And we'll go into a clinical setting or a non-clinical setting, and we'll talk about housing. We'll talk about transportation.
Those social determinants of health.
Those social determinants of health. Before I came here, just realized that some of the funding out of our institute were going to pack and plays. And so the cardiologist is dealing with pack and plays for, of course, mothers and babies as they transition out of the hospital. And so we link people to food, we link them to housing, sometimes we assist with utilities. So really that community-facing part that's often non-clinical, that is so important to making sure people have access.
Very much so. So you're talking about those social determinants of health. What would you view as the most important one? There's so many different ones, but what would you view as the most important one?
So,
and how are you all
So access is still key. If you don't have access to a hospital, or if you don't have access to providers, if you don't have access to resources, you cannot be healthy. So I like to frame the answer to that one in terms of access. But now, since we've had our community health workers really engage the community, I was surprised that transportation is the #1 thing that we addressed when we visit families. And so helping patients reach their destination and come back from their healthcare providers is crucial.
Wow.
And I would not have thought that was
not at all.
#1. I would have thought it would be food insecurities and housing. But transportation is key, which also is important that we have an access point like a hospital so that people aren't traveling far distances to receive their health care.
Yes, absolutely. I actually thought, like you're saying, instead of transportation, it being more like food, and particularly adequate food.
Sure.
So can you speak to that in terms of, gosh, when it comes to congestive heart failure and also high blood pressure, just the food that we should be engaging in?
Yeah, so we're in a food desert here in West Louisville, no doubt about it. Not only are we in a food desert because there are very few sit-down restaurants, very few grocery stores, but the food choices that are available are not often the best choices.
A lot of
fried foods, a lot of prepackaged foods, canned goods.
Ultra processed.
Things that are high in salt, which is directly related to hypertension, which is directly related to congestive heart failure.
Yeah.
And so by addressing these disparities, I get a 2-for-1. Not only do we provide people what they need, but you also decrease the likelihood that they will go into congestive heart failure.
Wonderful,
Yeah.
wonderful. So there's some other aspects like, we tell our patients to exercise. But when you're in areas that are not as optimal in terms of getting outdoors,
Sure.
getting that exercise,
Sure.
and sometimes
Yeah.
your space is not as optimal inside. So how are you all addressing that in
So
terms of maybe making our
very important.
area
And so,
safer?
and this is really something for providers to hear. Often giving a patient a prescription for exercise should be given with a little bit of understanding. In the West End, very limited green space.
Yes.
And when you exercise, there's not a lot of green space. Safety may be an issue. And so telling a patient to go exercise and the environment is not optimal may not necessarily be the best way. And so sometimes the exercise prescription needs to be things that you can do in place, standing in place to get your heart rate up,
Okay.
things that you can do maybe in a controlled environment that involves video,
Okay.
things of
okay.
that nature. So the answer is you still need your 30 minutes a day, but understanding that exercise is not the same with each particular patient.
Yeah, yeah. So really kind of personalizing
Making
the
it personal.
the prescription,
That's
really.
right. And then figuring out, one of the most important programs we did was Walk with the Doc.
Yes.
And so having myself as one of the providers walking around the sports and learning complex with over 60 to 70 patients, explaining to them why exercise is important, goes a long way, because seeing your physician in the community doing things like you're doing is important.
Wonderful. And that is great. I forgot all about the Norton Sports Complex. Now, Norton is really in the community when it comes to that. So
excited.
that is wonderful. And that facility in and of itself has an outdoor area and also an indoor area.
Yeah,
So,
and we also do educational events there. Like
Okay.
I did the Walk with the Doc. We did a lot of our community briefings to help the community interact with us during our survey time to figure out, yeah, we're building a hospital, but what do you want to see as a community member? And how can we make sure we represent your wishes as we build this hospital?
Wonderful.
Yeah.
So we are still in, unfortunately, or quasi pandemic.
Yeah.
So how has the pandemic actually affected some of the work that you're doing, both with the Institute for Health Equity, but also with the whole, congestive heart failure or heart failure program?
So the pandemic was extremely challenging for everybody. On one hand, it unearthed a lot of healthcare disparities and drew attention to things that we should have already been addressing.
Absolutely.
But it also forced us to think differently about healthcare, how we provide it, how quickly we can move. One of the things that we were very instrumental with this location with St. Stephen's is we provided vaccinations to the elderly and the African American community first. And this was with the relationship that we had with the governor. He wanted to make sure, and we wanted to make sure, that our historically underserved populations had access to the vaccine. And so what you saw was us engaging all community members, starting with our faith partners, using our mobile units to bring access to where folks were instead of asking you to come to our facility.
Meeting people where they are.
Meeting people where they
Yes.
are. And so we learned that through the pandemic and how important that it was. But it also forced us to think about how we deliver healthcare. We were forced to be creative with telehealth and video visits. We all
Yes.
got good with that. And so the pandemic was challenging, but it forced us to grow, and it forced us to put resources in a different place.
Wonderful. Well, kudos absolutely to you, Dr. McCants, and also to Norton Healthcare just overall. Just absolutely phenomenal work that is being done and that will continue to be done. One last question that I have for you, as not only a cardiologist, but also an advocate for health equity. How do you, Dr. McCants, take care of yourself?
Very important. So I have hypertension, 46 years old. So the first thing I do is take my medicines.
Okay.
So what
The doctor taking his own
doctor takes his
okay, all
medicines
right.
is the most important thing that I can do for myself.
Okay.
Because if I don't control my blood pressure and I don't understand the challenge of taking medicines, how can I explain that to you?
Absolutely.
So I exercise every day, including Sundays.
Okay, okay.
Over the last 2 years through the pandemic, I've become very familiar with the treadmill, and I'm working on the diet piece. As we
That's
mentioned,
difficult, yeah.
As we mentioned, I own a restaurant, so food is my thing, and I like to cook, but I'm watching that part also. And then mental health.
Speak to that, please.
It is a big deal, and you can't minister to patients if you're not healthy. And so I make sure spiritually I'm in the right place, mind, body, and spirit.
Spirit, yes.
And yeah, so I take care of myself.
Wonderful. Well, again, kudos to you, Dr. McCants, for the work that you're doing not only as a cardiologist, but also as the head of the heart failure program, and then being the health equity advocate that you are. Thank you so much, and thank you to Norton Healthcare for all that they're doing, all that you're doing with Norton Healthcare. So thank you for joining us for another episode of Healthy Mind, Body, and Spirit. Dr. Giavonne Rondo. Have a good day.
Thank you.